Let's see.
I never know if it's going. I'm going to wait a second. So we hit live. I don't know if we're actually live, though.
There it goes. My phone just updated.
Let me know if you can hear us and if you can see us.
There's yours.
Zach's got our phones over here, and he's doing the monitoring for us.
Let's give it a minute.
I know, it always takes a second.
Yeah, I think we're good.
Do you want to turn up the volume on one of the phones? Just make sure you can hear us.
Yep, they can hear us.
Oh, cool.
Thank you, Linda.
Hi, guys. It's Maggie and Zach. We wanted to do a live stream today because my channel has grown a little bit over the last month, overwhelmingly. And we thought we could just get on, hang out with you guys, maybe introduce ourselves again on here. Although we've done that
a few times.
Just a couple times.
Your intro introduces us too, so.
That's true. That's true. Well, we don't get to talk in the intro.
That is fair.
How are you guys doing? I hope everybody's
happy Sunday.
Feeling good. Yeah.
Nearing the end of February already. 2 months down this year.
Our last live stream was near Halloween.
Because we started, we had all like the candy corn banner.
Yeah, I pulled up StreamYards and my little Halloween banner popped up. And I was like, oh, we should probably get rid of that. Maybe I should have done like a Shamrock one. That would have been cool. I didn't sign in until 10 minutes ago, though. All right. Let me put our names up just in case. Because I don't know who's going to be on here. If it's going to be maybe newer subscribers or people who have been around for a while.
All are welcome.
Yeah, everybody's welcome. I've been doing this channel for, about 14 years. I think it was January of 2010, which is insane. So if you are just coming on to this and you're like, who the heck are these people? I'm Maggie. I have Crohn's disease, and I've been living with an ileostomy for about 14 years because that's when I started my channel. I was kind of searching for other people with ostomies online. And because of sharing on YouTube and connecting with so many people, I went to nursing school, became a pediatric GI nurse, actually on the floor that I got my ostomy, which was Circle of Life, and did that for a while until I needed my proctocolectomy surgery. Did telehealth ostomy nursing for a while. Not a WOCN, want to make that clear, but I did work directly with ostomy patients. And now this is what I do. So it's nice to see everybody on here. Oh my gosh.
Getting the comments coming in. Wow. Yeah, we're going to do our best to respond to everyone.
Destiny.
Give a hello, shout out to all. But
Julie.
And if I keep looking down, that's just me reading the comments.
Yes. And Zach here is the husband. We've been together for.
I was just telling it in my head before you brought it up, but
how long? Putting you on the spot. How long has it been? Because I don't know.
Graduated high school 2011. We met in 2012. So 12. Okay. Yeah, it's 2024. Years. So 12 years going on.
Not too shabby.
11 and a half
we've been
now.
Married for a little over 3 because we got married October of 2020. So he has been around for most of, the disease stuff. I already had my ostomy by the time I met him. So
it's all news.
Yeah, it's all news to him.
Yeah. Learned a lot, though, over the years just being with you and seeing the medical world through your eyes.
Yeah.
Honestly.
And you've done great with it. You did my bag change a few months ago.
That's fun.
You did awesome.
Did my best. Did the best I could. So.
Yeah.
Is it the chair?
Yeah. So these stools are having some issues. Yeah. I have fixed them about 5 times in the last week.
Yeah, they're not the best.
The bolts keep popping out. So if you see us fall, that would be why our stools here are not well made. Let's see. Oh my gosh, there's so many people.
Do you want to run your intro? You said to make sure. Oh, I
forgot. Yeah.
We're gonna do a quick intro for everybody.
Yeah, just throw my intro in the beginning here, the one that's in front of all my videos. Okay. Ready?
Be right back.
I knew I was forgetting something. I had to throw that in there because I can do that with StreamYards. I love it.
It's great.
Let me go back to the comments now. Yeah, I need to use this more. Yeah, so I don't know if anybody has any questions, but we just wanted to hang out for a little bit.
And yeah, hopefully everyone's off to a great new year. It's hard to believe. Again, 2 months in. Last time we did the live stream was October. We've done, I think, a lot since.
I hear a dog crying.
Oh, that might be, I don't know who.
Who is that?
Actually, yeah, sorry. One of our dogs is whining in the background.
If you hear a dog crying, they're fine.
Might be Bruno
they're
because
all
he hurt his
separated.
nail.
Oh, is it Bruno?
I don't know. But
Oh, okay.
nevertheless, no, I was saying, yeah, it's a great start to the new year. It's been we've done a lot since October. I think the biggest trip we took recently was out to Vegas. I saw we had someone here from Vegas. I saw that pop up.
We had a great time. It was awesome.
It was a blast.
We were there for 5 days. And as many of you know, we did the conference. Well, I did the conference. I keep hearing one of the dogs
I'll
crying.
go check.
Okay, go check on the dogs. Yeah, so we were out there for 5 days. I did the conference like the first 3 days. And then the last 2 days, Zach and I got to explore Vegas. Now, Zach was not part of the conference, so he spent the full 5 days basically touring Vegas. You went in every casino, I think, on the Strip.
I did. I had a lot of free time, downtime, so I basically just walked and explored everything. I got about like 12 miles in a day of walking, which is great. Like, I think 60 miles or 50 or 60 miles on the trip. But, yeah, pretty much did and saw everything there. So I'm good for the next few years until all the hotels are torn down and rebuilt.
Yeah, so we stayed at the Bellagio when we were there for the conference. Thank you, 𝙗𝙪𝙨𝙨𝙨 Foundation. That was incredible. And then because, it's very expensive at the Bellagio, we went to the Tropicana.
Which is a little different than I think we had expected.
It's apparently going to be torn down.
A little sad. It's in
a few months. But it was really cool. And they had a really beautiful pool area, which is what I guess they were known for. But it was all closed off, so we couldn't even go out there to look at it. We do have a dog visitor who wants to knock the microphone down. If you pet her once, she's going to beg for pets. I wish I could lift her up. All of our dogs are big, though. So if you didn't know, we have 4 dogs. We've got Bruno, who is like a lab mix. Yep. Holly, who is a Shepherd lab mix. Nanners, a Staffordshire Terrier, who is
a potato.
She's a potato. She's just a quiet little dog that you wouldn't know you had a dog if it was just her. So she's under my desk. And then Dixie, who is currently pushing us for pets. So if the mic topples over, you know why. It's her. We like dogs. It's mainly my fault.
I like
Let's see.
Yeah, sorry, I'm trying my best. But yeah, we can do some I just can't believe it is already February.
I know.
But
I'm looking over at comments here, so don't think I'm ignoring you guys. Yeah,
because really this is for you guys to ask any questions you want from mainly her. I can answer some too, although I don't know if anyone's here to see me. But
I think that they are.
Let's see. I'm going to go from the top. We got hellos from Australia, Jersey, Ohio, North Carolina. I'm seeing Vegas, Maine, UK, a little bit of everywhere.
Wow.
Lansdale. We were there not too long ago. Well, 7 years. Let's see.
I see one question about the weddings, and if you've seen some of my vlogs, you'll know our township problems. So no, we are not. We're not doing that.
It's a whole ordeal in itself. We are in litigation, I would say, is the best.
We're not the biggest fans of our township, so
no. But still pursuing the legal route. Unfortunately, it's going to take a while. So
yeah. I do see a question about barrier rings, which I know not everybody here is probably living with an ostomy, but it really depends on what you are looking for. I think Hollister's Adapt rings are really good if you're having trouble with leaking. I think they stick really well. I like the Convatec ones because I think that they mold the best to uneven skin. Those are just the two that I have probably used the most. I did use the Brava ones, but I had trouble with them sticking to me. But some people, it works really well. And then there are a bunch of different ones. There's Ostoform. That one's really cool. That one has like a little spout that helps drain to the bottom of your bag. I think Safe and Simple has one. Trying to think what else. Yeah. But Hollister and Convatec I really like.
And I saw a comment a little further up, Mags, about someone, I think, having the same procedure next month. So I always like to just, from your perspective, any advice or just quick pointers or tips?
So I can put it up on the screen.
It is, oh man.
I know.
We're already losing the comments. Here, let me see.
I'm really good at that. I just want to make sure.
But yeah, just any advice or pointers for people with the upcoming surgery or just going into it, what they can expect, or
if it's ostomy surgery in general.
There it is.
Got it. Let's see. Okay, I don't know what procedure it is, but if it's ostomy surgery, I always tell people order all the samples so you have them before you even have a stoma. Just so you, Nanners, can you stop licking? Just so you can have a variety of products to try. Usually the hospital is contracted out with a certain brand, so they're going to send you home on that. That doesn't mean you have to stick to them. So I always recommend that, but I also know that it can get really overwhelming with how much is available out there. So
she had a colostomy and then needs a rectum
removal. Oh, okay.
Sorry, well, the comment was further down.
That's all right. Rectum removal.
We're trying our best to go through comments. We're not.
Yeah. So with that, the best things that I did before that surgery was to mentally prepare. That helped me absolutely the most because it's a difficult surgery. Can't lie about it. It's a difficult thing to go through. And telling myself that and understanding that things might not go perfectly, but they'll be okay eventually, really helped me in the hospital. I also constantly reminded myself in the hospital that, keep working hard, do all the things that'll help you remove an IV or remove the catheter or remove, I don't know, what else was attached to me? The JP drain that I had. I was working towards getting onto oral medications closer to discharge. And every time a tube was removed or something that was stuck to me was removed, I felt a little bit better and more encouraged. As for recovery, I loved my waffle pillow. I worked with a colorectal nurse practitioner, Karen, who thankfully I get to work with again. We just got together on another project, but she was such a wonderful resource. And she told me, get a waffle pillow. It's like $20 on Amazon and blow it up halfway. So that way you're able to sit on it and sort of tilt back and forth side to side to take pressure off of the incision. If you have an incision, not everybody who gets their rectum removed winds up having a full closure. And also just because it's so sensitive down there, trying to keep the incision dry, trying to keep the area dry. Walking upstairs was a little bit difficult, so I had to modify how I walked upstairs. And I used a step ladder to get into bed. So those were the main things. That's what helped the most. But just the mental prep was absolutely by far the best thing I could have done. Because I had another surgery. Remember the kidney surgery? I went into that.
That one was, I think, rougher for you because there was no mental preparation. It kind of just snuck up and. Yeah,
I just assumed they were resecting a small piece of my ureter because it was, I guess, narrow. And I thought, out of all the surgeries I've had, this is going to be fine. Like, this is easy. And that wound up being the most painful and roughest surgery and recovery I ever had. It was just, oh my gosh. So if I ever need surgery again, I'm just going to mentally prepare as best as possible.
I took the mouse.
I was reaching for the mouse. I'm like, it's gone.
And I had a question. I don't know this acronym. Are you SSI or SSDI?
I believe that's something like Zoloft. I believe. Oh, no, that's SSRI.
Sorry, I didn't know the acronym.
Oh, no, no, I'm not. This is like, what's the word? Somebody help me in the comments. No, I'm not. I'm not on that.
Not a question, but I'll take this one. Love our relationship.
Thank
I do too.
You better.
I got no complaints. Very helpful.
Thank goodness you're doing this because I'm the worst.
I know. That's why. Sorry, guys. I'm just kind of all over. I'm just trying to go through this so we get everyone's questions answered. I
told him the other day when I planned this that I had a dream about us live streaming, and I started the live stream with him here, and then he was like, I don't feel like doing this. I'm going to go do my own thing. And I was left there trying to go through the comments and the questions, and I was like freaking out. We already
answered that one. Yeah.
I was jumping all around.
What is the did you answer this one as well?
I did.
Okay. Sorry. Oh, I'm just trying to get it caught up. Oh, man. Oh, I did see this one. And I actually asked you about this earlier.
I am. Time has been not a lot. There's not a lot of extra time going on here, but I do have plans. I have all this stuff written out that I want to talk about on that channel because doing this has been so rewarding and fulfilling. You know, I became a nurse, and it was kind of disappointing to have to leave the bedside because of my physical needs and like having to go through surgery. And this has just completely filled that. Like I love that I get to talk to patients, and I know that many other patients who go through all sorts of different things want to speak to patients. So I do have plans.
And backtracking, the SSID is Social Security.
Yeah. So I'm not on that.
And then I did see.
That's actually something. If somebody is, or on disability, I would really love to chat maybe in a video with somebody who can talk about that, because I don't have that experience to share about it.
Yep. So if anyone wants to chat, give Mags a hello. And then I saw another question came in. What do you wish you knew before you had your stoma? And I don't have one last part of it, or one, but last part of my bowel as a result of breast cancer treatment, still having issues, which we're sorry to hear, Francine. But what do you wish you knew prior you had your stoma?
I wish I knew it wasn't as scary as it seems. I had actually met some people before I had ostomy surgery, before I even knew it was going to happen. I met a camp counselor at Camp Oasis who had gone through J-pouch surgery and had an ostomy for a few months. She actually helped kind of mitigate some of those fears because she was so relaxed about it. Like, yes, this happened and it was unfortunate, but I got through it and it was okay. But it's still like, it's really scary. Your intestine is hanging out of you. I know that that's like wild. It feels like such a wild concept. And now looking back, it's just so regular to me that I would fear if I had to go to the bathroom the regular way. Like, I don't know how you do it. That's weird to me.
Depends on the day.
Yeah, that's kind of how I feel about it. I wish I had known it wasn't quite so scary, and that it certainly can be manageable and can be, you know, I have seen some regularly colon rectumed people struggle with their bowels, and sometimes it's really convenient to not need a restroom immediately, and to just kind of be able to go to the bathroom wherever. You don't have that ability, so
I don't. You know. Unfortunately, you keep trying to go for this mouse. I got it.
We need to.
So another question come up: what kind of foods have you stopped eating? Which I know, I feel like this question is frequently asked. I know you've done videos on this topic as well, but I guess just dietary constraints that you've experienced with your, since you've had an ostomy, Crohn's, anything related, or pros and cons.
There aren't a ton of things that I had to completely stop eating. I actually found
it varies from person to person.
After the ostomy surgery, I actually found I could eat quite a bit more. But the things that I fully avoid are raw vegetables, especially stuff like broccoli, because I did give myself a blockage pretty bad one time where I had to, I won't go into detail, but I had to extract things from my stoma.
Yeah, broccoli I know is notorious. Like, it can be a challenging one. Aren't like legumes also difficult for many people?
They can be. I've had issues with that because I don't chew well enough. You really have to chew well, and I'm trying to think what else.
What about foods that have been beneficial that have actually helped you more? Would you say
anything that is starchy, like potatoes, mashed potatoes, all of that has been. Did you say potatoes?
I did.
Anything like that has been really good. I love sourdough bread.
Although trying to make it's been a little challenging, to say the least. It's not been going well.
I have been trying to do sourdough starter for months.
Yeah. Any tips, pointers are welcome. The first time you tried it, or one dog, Bruno, ate all of the starter and had some GI issues himself thereafter. And now this time it's just not.
It's just not
starting.
It's not doubling in size ever. I had it going for like 2 weeks, and then eventually it just grew mold. So I'm gonna have to keep buying it at the store. I don't know what to do. What else? What else do we? I really like squash. Squash works well. Butternut squash is one of my favorite things. And then I will say, I know everybody's got their different dietary preferences. I was pescatarian for 8 years, and fish has never sat very well in general, even before ostomy surgery. It just, I don't know, it doesn't stay with me. But then I started eating meat again like a year and a half ago, maybe. And that has, I think, really benefited me. And I actually gained like over 10 pounds, which I've never done. So though, just, I think like good sources of protein and just making sure you actually get protein. I don't think I was getting enough before.
So another question, gonna move on to it. I want to try this. Have you ever heard of visceral myelopathy? That is what I finally got diagnosed with. The stoma is a struggle as my bowel is lazy.
I have not, but that makes me think of like motility. I might be completely off. I apologize.
Yeah, I am also not familiar with the term, but perhaps something we can.
That makes me, okay, reading just the words.
Yeah.
It's making me think the nerves are not, things are not moving through your intestines. That's what I'm thinking. But I could be totally wrong.
Sorry,
so
don't.
My channel is not medical advice, but more sharing my own experience and how I've managed things.
And a community for everyone to chat and interact with one another.
Yes. So if anybody else has dealt with this, please let Carrie know. I apologize, I don't.
Another question is surgery having big issues with depression. How do you deal with depression or any other just mental health issues, concerns, and any advice?
Oh, this is
a tough one.
This is a tough one. It's a good one. Gosh, after surgery, I did deal with a short amount of time where I was just so down because I didn't expect what happened to have happened. The ostomy was kind of a surprise to me, and I just felt so miserable. I thought life was over. I thought, I played soccer at the time. I couldn't do that anymore. Certainly I couldn't go to school. There's no way I could leave the house. And slowly I did find over time that was not the case. But that's not what happens for everybody. Any kind of surgery can be really, really difficult. And I think just making sure that you're there as a support network to that person as much as you are willing and able to is so helpful. I had dealt with PMDD for a while, and Zach certainly saved me a number of times. He was my rock during that, and I'm grateful for that. Not everybody has a lovely husband to be supportive of them, or a caregiver or a parent, and friends can also, be a wonderful resource and take that place. So if you're able to support, and just don't tell them everything's going to be all right. Don't tell them everything's going to be perfect, because it's not going to happen.
Just be real.
Just
be
real.
A normal human there.
Just listen when they want to say, you know what, life sucks right now. I think that's been one of the most helpful things that I have
As I always say,
received.
there's not always an answer or a
No.
solution to everything, unfortunately, and just being there or just
Yep.
can be the answer in itself. But yeah, it's a tough question. Not always the easiest answers, but that's just
But the
some
fact
of our,
you're asking about this is, I mean, it speaks
Yeah.
volumes about the support you're already giving. So clearly you care, and that's awesome.
So you got a few comments of people that are on disability that can provide advice, or you can chat with
Awesome.
maybe after this or in a later time. So we'll save the names and reach out to.
Okay.
And
cool.
then another
I think
question is about scar tissue, and I know that is something you do have, but
hopefully not for a little bit. I did have scar tissue. So that was actually going back to what I was saying about the kidney surgery and how I didn't mentally prepare for that. When they opened me up to just remove that little bit of ureter, turns out that I was covered in scar tissue. He said I had adhesions everywhere. And so this surgeon gave me a 2-for-1 deal and said, let's get rid of these adhesions. And they took them all out, which hurt. I mean,
yeah,
that was a rough recovery, not so much because of the ureter, but because it felt like I had been scraped clean from the inside. The way I always explain surgery pain or like that post-op healing pain is it feels like you did a really hard ab workout, at least to me. It felt like those muscles had just been stomped on and torn to shreds. It was absolutely insane. I felt like I couldn't move. But what I found after I got that scar tissue removed was I feel so much more able to move around. I didn't really realize how restricted I had gotten. So
yeah,
I'm grateful, at least hopefully for a couple years, because it can grow back. Of course, every time you go in for surgery, it can build. I still feel pretty good, and I still feel limber.
And sorry if I missed it, but massaging the tissue or the area of the scars also it proved beneficial. I know that's something you've had to do or request I do.
Yeah. Well, yeah. Okay. So in pelvic floor therapy, I had mentioned to the pelvic floor therapist when I went a couple years ago that like I was hopefully interested in getting pregnant one day. And so she explored my midline scar. If you haven't seen it, I'm sure there's a video on my channel that'll show my midline scar from my ostomy surgery. Because that, I already have some risky tissue on my belly that as your belly grows, is that going to tear apart? Are my muscles going to separate? Yeah. So she explored that. Thankfully, she said, it looks like your tissue is strong. It looks like your musculature is strong and toned. But with your scar, it's a little bit hard because scar tissue is not quite as pliable as your healthy, unscarred tissue.
Your battle scar.
Yeah. My battle scar.
As people are joining in, I keep looking down. I'm reading all the comments as they come in here. So we are trying to get to everybody. We usually end up being a little bit behind. But
with that scar, though, they did massage it. My pelvic floor therapist massaged it. And then she had me do it at home. But because it's completely numb, it freaks me out. So he had to do it. That's all I want to say. Continue.
Yep. So I got a question for me, and I can answer this one. Cool couple may ask what Zach's job and zodiac sign is. So I am a Scorpio, and I
didn't know that.
Yeah, October.
I never looked it up.
I work in finance, particularly in commercial real estate. So that is my main, main job and zodiac symbol. I get a question, easy one.
I had somebody ask if you were in the medical field too, and I was like, no.
No.
You had interest
vicariously through her. I am in the medical field, but that is about it. I did when I was younger. In high school, I was like on the track to originally want to go into veterinary medicine or along those lines, but it just kind of, never ended up going that route. Ultimately, life, takes you places or paths that you don't ever know or foresee.
Yeah, for better. So we always say we never know where.
Yeah, 5 years, no one knows what they're doing. Yeah, don't even.
No, can't make plans.
Use the one that I know you've had. So
last night, that's what was happening.
Tips for bladder spasm.
Yeah, I hate them. They are awful. I get them when I ovulate and when I get my period, and it's terrible. And then when I have a start of a UTI. make sure that you're not getting a UTI. That's the first thing. When I get UTIs, they're really, really terrible. And I go to the doctor and they make sure I have one before treating it. But when it's not actually a UTI, I have taken Urocalm. That's something, make sure to check with your doctor. That's helped me a ton. Turns your pee orange.
Which is terrifying the first time it happens.
Yeah. The other thing I do is I will drink mint tea. That's actually, I read it online because I had the same like desperation because it's so annoying. It's so irritating. I read it online and I thought, I've got some mint tea anyway. Let me try it out. It actually did feel effective. And I also drink a lot of 𝙗𝙗𝙗𝙗𝙗. I've had them in the like capsule form, but I found that drinking the powder, like adding powder to water, was a little bit more effective. That helped me a ton. That's more for if you have a UTI like E. coli, but yeah, those are the things that have helped me.
It's backtracking a little, but back to food. I'll get to that one in a second. I see some people saying onions are a no-go, mashed potatoes, always delicious, and fish have been helpful for some. But carbonated drinks, do you have any? And as you are clear, she does.
I love my seltzer. Some people on this channel know a few years ago I got really into bubbly. I was trying all the flavors, and then I kind of fell off of it. But recently, I got on the seltzer water again. I don't drink a ton of soda. Yeah. I maybe have a Diet Coke or Pepsi. Twice? Maybe 3 times if we're getting wild.
Yeah, we don't. I think either of us really drink a lot of soda. I usually do black cherry a few times a year, but that's it.
I actually found if it's like sugar, like a sugary drink, I usually don't feel too well. I kind of get bloated. So if I get something like a soda, I usually get sugar-free, which I know is not great for you either, but at least I don't feel terrible after drinking it. And like I said, super rare for me to do it. If it's carbonated, it's probably seltzer water, and I seem to be okay with it.
So I missed a question, apologies, but not a medical one. Have you started any seeds inside yet for your garden this year? And that's unfortunately, we have not.
So I didn't even tell Zach this yet. I have plans for the garden.
Uh-oh.
Yeah, put him to work. So
yeah, I'm unaware.
You know our porch between the house and the barn?
Yeah.
Okay, and you know how like a couple years ago I wanted to do hydrangeas there? Well, forget that.
Okay.
Just a small little garden.
All right.
For me to do my green beans and my cherry tomatoes.
Love the green beans.
I want to do cherry tomatoes, the one that like grows wild on our property.
Which we love.
It's basically a weed at this point. The green beans that I love, and then Amish paste.
Okay.
Remember those? They were so good. And I get them from Baker Creek. So I haven't started them yet, but I probably should. I know I'm not anywhere near what I was like last year. I totally got bummed out by that Mother's Day freeze that killed 90% of what I grew. And my garden was terrible last summer. So
yeah, that was.
I really should start the seeds. I need to get the soil, and I like the Fox Farm soil. That stuff's really good. Yeah. But it's expensive, and I've just been dragging my feet.
Another question that came in: how often did you have to use the bathroom after having an ostomy? I may be looking at getting a colostomy and was wondering how often I might still have to go to the restroom.
So after surgery, like immediately after surgery, because I had a rectal stricture, I wasn't going to the bathroom. And that was a problem. We didn't know. Nobody told me that you should still be, if you've got some bowel left, if you've got a rectum or some of your colon even, you should be producing that mucus and passing it. Or you might be passing old stool that hasn't quite made it through. When things were discovered and when that stricture was opened up so I could, release that mucus again, I would say at least once a day when I was not doing too bad. As the years went on and diversion colitis kind of took over, which is something that I would definitely ask your doctor about, depending on how long you have an ostomy without doing anything to your lower bowel. I was in the bathroom for a couple hours every day. Right. Like right before surgery. That's why I got everything removed, because it was just miserable. I would say 3 to 4 times a day, at least, I would get that urge to pass the mucus. So, it's going to depend on you and how much bowel you have left and how much mucus you produce. So as long as you don't feel like you're getting bloated, that's what happened to me the first time around when I didn't know I should be passing it. I got really bloated and didn't feel good. So,
and this is actually a easier question for you, and we always welcome, again, we're doing this for anyone that's new to the channel. What is your reason for needing a bag?
So I have something called Crohn's disease, which is a type of inflammatory bowel disease. Hence, let's talk IBD. And the Crohn's disease really attacked my lower bowel, so my colon and my rectum and even the anal sphincter. And so when I was 16, I went in to get some resections of my intestine. That means just removing pieces of it and kind of connecting the pieces together again. And about a week after that surgery, those connections fell apart inside of me. I wound up with peritonitis, almost died, and my surgeon placed a stoma, which basically means just my small intestine coming out of my belly, and I wear a bag to go to the bathroom. It was supposed to be temporary, but I felt so much better, and I wasn't spending all these hours in the bathroom. I mean, I was 16, so that was all of my life, basically. I felt like I was stuck in the bathroom. So I didn't go back to get it reversed, and I kept going with it. And as time went on, my colon and rectum declined, and in 2019, I made it permanent by getting rid of them. So that's kind of the story, but Crohn's disease is the short answer.
And again, anyone that's new to the channel, we welcome all questions. Anything.
Don't be shy, because I know that, like, when I talk about this and people aren't familiar with either the disease or ostomies, it's like, whoa, what the heck is going on with that chick?
So I saw another. Oh, I just lost it. Scar tissue. Another question on scar tissue. You had removed your nails tube every day for school. Do you have scar tissue from that?
I don't believe so, but I do have a slight deviated septum. Like, if I were to try to put a tube down now, I wouldn't be able to do it in my right side. So I don't know if that was caused by the feeding tube, but like I could certainly see it, because every time you pull it out, you're pulling stomach acid with the end of the tube.
That's what
and
I
it
did
was
once
like
for you, right?
Yeah. And it was, I mean, you can taste it. It's not fun. So I'm very grateful that I don't have to do that anymore. I don't know. Maybe that's why I have sinus issues too. Who knows?
So I think it was another. Yes, I saw. I was surprised how small you are that you didn't have a laparoscopic surgery for your ileostomy. And was it because it was an emergency?
It was. Yeah. So the original surgery with just the resection was done laparoscopically. And I showed Zach the other day the scar that I still have from that very first laparoscopic surgery. You would not be able to see it. Like, I had trouble finding it on my belly. And that's how it was supposed to be. But because I was knocking at death's door, I was throwing up what is supposed to be in your colon and rectum, which thankfully I don't remember too well because I was so out of it, but they had to just do a big open incision to really clean me out.
So it really,
my surgeon was very upset about it.
Very much an emergency, and it saved her life effectively. So another question, kind of related to scars. I guess, would you have to have a cesarean?
So not necessarily. If any of you guys know Megan Brown, she's on Instagram, she's on TikTok. I believe it's EMC Brown, EMC_Brown, something like that. She had 2 vaginal births, and she's had the same exact ileostomy, proctocolectomy, full closure.
Sorry, I'm multitasking.
We went to lunch with her. So you were our videographer.
I was.
Yeah. Remember, she's tall. She's so much taller than me. That's the one thing, as soon as I met her, I was like, hello. She's had 2 vaginal deliveries. It was something that her OB/GYN actually said, like, we think you're going to have a cesarean. And she said, well, can I actually do not that and try to do vaginal delivery? And she did. So I do have a video with her on my channel, actually.
Yep.
It's like pregnancies
Yeah,
with an ostomy.
you guys are talking about this. Yeah.
Exactly, yeah. So that is on my channel.
Check it out. So not really a question, but I've seen this. Do a collaboration with Dr. Mike or Mama
A while
Dr.
ago,
Jones.
I know a couple people were commenting on Mama Dr. Jones' video saying, talk to Maggie. Because I think I was talking about how I was experiencing pooling after rectum removal.
Yep. Which I know you're open to it, but yeah, we'll just see if they reach out or go from
They're fantastic, both of them.
Do you have any more diagnoses besides Crohn's? I also have RA that is crippling. So do you have any other diagnoses or I know you have familiarity with a lot of other ones, but
one that people don't know that I have is asthma. I had very severe asthma as a child and, had a big nebulizer and was on inhalers all the time. And then I got diagnosed with Crohn's. And once I started treatment for Crohn's disease, the asthma gone. So I have not, other than like when I get sick, like I still have that cough from a month ago. Other than when I get sick, I don't have any issues. I have not had an asthma attack. Somebody knock on that wood there, because I'm not screwing around with asthma.
The dogs all go off.
Oh yeah, they'll think somebody's at the door. I had pretty bad asthma attacks, and it was absolutely terrifying. So
yeah, thankfully, not really recently, like you're saying, but
yeah, no, the last one I had, I was maybe 9 or 10.
Yeah, that's before I knew you.
Yeah. And then like adenomyosis, but I don't even know if I really have that, because I had the HSG, which I don't think can always pick up on it, but sometimes it can, and they didn't see anything. And then PMDD. So
next question. Do you have any issues with the ostomy flange while swimming or using the hot tub?
Sometimes not. It depends on how long I'm in there.
No,
if I'm in there for a long time, I have one of the Hollister flanges. I have ostomy supplies everywhere from the accessories video and the bag video I just did. But if I go into water and I'm in there for a long time, I will actually have the edge peel up, but it doesn't go far enough inward that I worry about a leak. And I've actually noticed, especially if I'm in the ocean, if I'm in salt water, it'll stick back to me after a couple hours when it dries out. Otherwise, no. I know people use flange extenders in the ocean. I don't seem to need to do that, but some people find it helpful. So
this is just going back to a question that came up earlier, something we were unfamiliar with, which is
nerve.
Visceral myelopathy is a nerve issue that it basically doesn't contract. It was either that or Crohn's, but never go to the toilet. And he said it's
You're struggling to read that, aren't
more
you?
commonly seen in visceral So
okay, so I was kind of on the right path there.
There's another question. Oh, I lost it.
No, where'd it go?
And it's so small to see. I think this was it. An ostomy group I belong to was discussing what to keep output less liquid. Oh, so I just wanted to bring this up because I know this is all maybe not pertaining to this. It's more of a comment, but just ostomy groups or awareness. Is there anything that you would recommend or give to advice to people trying to Facebook.
Yeah.
Outside of just that.
Well, UOAA has in-person support groups, and I believe they also do some on Zoom. So they're a really great resource, and sometimes they'll have nurses come in to talk about products, or different ostomy companies come in. But I really like Facebook. There's Girls with Guts on there. They're fantastic.
We met them too.
Yeah, we did. If you just search ostomy groups on there, I think they're the most helpful. Every once in a while, there are not helpful comments on there, so you just have to be aware of that. But I am constantly, I think every day I'm reading something from somebody on there. So
does one get diversion colitis?
Wait, did I answer the question? You just asked me about support groups, and that's not what they were talking about.
Oh, there wasn't a question. Or did I miss it? I'm sorry. No.
Okay.
Yeah. I think you answered.
I know there's that new, well, not super new, Gadex. By Takeda?
Not sure if it's sorry. Well, you would know better. But does one get diversion colitis without having colitis?
You can, yes. Diversion colitis is just because your bowel is not getting the nutrients that it otherwise would when food's going through it. So it is something to keep an eye on. It's not dependent on having something like Crohn's or ulcerative colitis.
So, and I saw this come up a few times. I don't know if you're aware of this topic, spina bifida. I don't know what it is or know well.
I was just watching a show. Do you remember? I was watching my show and there was a case of it and he said, I bet that's spina bifida.
Okay.
I was watching Call the Midwives. I just really got into that show. But there was a case of it. So, and I brought it up to him and clearly you didn't register it. I know that a number of people have gotten it because of incontinent issues. So,
and I don't know, do you know what this, there's a question, still taking Azicol, and then there's a question below, what is it?
It's an IBD med, but I'm less familiar because I think it's in the same class as like mesalamine. Maybe I'm wrong. I'm not as good with my IBD meds anymore.
Quick fun question, easy one. Have you gotten enough snow this year? Well, this is a subjective. Well, you say yes.
Oh, well.
I think we need more.
I'm happy that with what we got.
We've had a lot this year.
Not to say I wouldn't like more.
We had probably 2 recent snowstorms with a cumulative total of like 1.5 feet to a little bit more. But I would like to see one more big blizzard before the end of March, maybe 2 to 3 feet.
Yeah.
Additional. We love the snow.
My favorite is everybody just shuts up and goes home.
We have a road pretty close to our house and it's just quiet outside.
Well, I had one morning where it was like so peaceful outside. There was probably 8 inches of snow out there. And all these cars were driving by. So I yelled at the road, go home. I know not everybody has the luxury of staying home during a snowstorm, but I just like the quiet. Everybody, kind of calms down. It's a peaceful day. So I could use another.
So not a question, but I'll turn it into a question. Is not receiving medical advice in hospitals by doctors, nurses, whomever, or just hospital facilities as a whole.
Yeah.
What is some advice to get the answers or to the questions that you have? Where would you go? What would you do? Or
unfortunately, that is very, very common. That was my experience. When I first got my ostomy, I had a leak, and the nurse's plan was to put paste underneath the flange where the leak was rather than changing the whole system. And of course, you know how that ended. Skin was destroyed. And that was something in one of my old jobs as a telehealth ostomy nurse, we found so much of. I mean, we found patients that were Spanish only speaking, that because there wasn't an interpreter available that day, they just sent them home and said, good luck. No supplies, no nothing. And it's just shocking. I think UOAA is a really good resource. I think the support groups are a really good resource. I've learned the most from other patients. I have seen firsthand that unfortunately nursing is just not taught it. The nurses that know how to care for it have seen it a lot, or, occasionally they've dealt with them themselves. So, it's shocking. And I think that's the case with many different medical devices, unfortunately.
And if one individual can't provide you the right answer, just start looking. You shop around. Is the best. Reach out to other medical professionals.
Well, that's the thing, though. As a new patient, say you've never dealt with anything in the medical world, you don't even know. So you're just going off the information that you're given, and that's your expectation. This is all I can get. This is all that's out there, and that's not the case, obviously. People don't know about wound ostomy incontinence nurses. They don't know about resources online. So it's just,
You mentioned UTIs. Did antibiotics mess?
Oh, yeah. I have been on antibiotics for my sinuses. I think
answer.
3 times since the summer. Yeah, it does. It does. And it's really frustrating. I think it really messed with it this last time the most. I've mentioned it on my channel, but I hesitate to say it because I'm not diagnosed with it. But it seems there may be a SIBO issue, and that's small intestinal bacterial overgrowth. And that can be, kind of enhanced when you're on antibiotics because you're killing basically all the bacteria. And so the bad ones get to take over. And that just really messes me up. So I do take probiotics. I don't know if they do anything. I have never noticed any difference with them. I just live on loperamide and hydration basically until things regulate.
Hydration is key.
Yeah.
But tying to that, do you take a daily vitamin? If so,
I was going to say I had it on my desk earlier, but I moved it to my thing.
Moved.
Yeah, I take Rituals prenatal vitamin. That's the one that I take, and it's got a citrus scent to it, which I really like compared to everything else. I used to, oh my gosh, I remember like all the vitamins I used to take, all the supplements that I was made to take as a kid, and they all just had this gross scent to it. And it was very similar to the vitamin C drops that I used to put in my guinea pig's water, and it was nauseating. So this is a little more appetizing.
I saw a question. I don't know if you'll be able to answer this one, but what are your thoughts on the national?
I don't know who that was.
Sorry.
Dixie.
I'll let you answer. I'll get her.
Hey guys. We have cats that are all around, and I'm gonna guess that maybe she saw one of those out the deck. Yeah. Yeah, I'm not a fan of the hospital bills, especially the ones that surprise.
The favors anesthesiology bill. The one time that.
Oh yeah, for my stupid sinus surgery, I go up to the desk as I'm checking in, and they're like, "We already checked. You're all covered. You're good to go." Lies. Apparently, the anesthesiologist was not part of the network. And what is she doing?
She got something in her mouth.
Nanners is a little goofy. It's not, in network, and so I got a $500 bill out of nowhere. Yeah, it's I don't like it. I don't like it.
No.
Especially when you're paying for insurance and stuff. Like, what's the point of it?
One more question. What is your best advice to be your own best advocate, Dixie?
Dixie.
When dealing with doctors. Yeah, they wanted attention and to be a part of the show.
It's one dog that needs attention right now. So this one's tough because I've certainly dealt with doctors who, aren't the best and don't necessarily believe me or have the best knowledge. I think the best way I've been able to advocate for myself is to educate myself. Not in like a condescending way where I go to the doctor and act like a know-it-all, but when you live in the body of the person dealing with the disease, you do have a type of knowledge that a doctor won't have, unless they also have the illness. And I have realized that some doctors will appreciate that and they'll listen to that. And I've also seen doctors that don't.
Yeah.
And recognizing that has been really helpful. And when I feel like I'm not being heard, I'm out the door and I find somebody else. But I don't know how good an answer that was.
You did your best. But any suggestions for support for someone with both urostomy and colostomy, finding it difficult to get support for I would
find Geraldine Taylor online.
Yeah.
She is a awesome person. You met her, right?
Yeah, no, we met.
Yeah, she is fantastic. She's a model, and she's got both a urostomy and a colostomy since childhood. Like, she got it because I think she had cancer as a young child. She is just fantastic in showing life beyond her 2 stomas. And maybe showing your husband her as well. I don't know. I don't know if that's the kind of support that you mean, but that's That's just what comes to mind when I hear of a double ostomate needing somebody. I think of her immediately because she's just fantastic.
She is. So, here was one more question. How do you deal with leakage and discharge from your filter?
You know what I do? I get a glue gun and I glue them shut.
You do, actually.
I do.
Yeah, you have your little hot glue gun upstairs.
I'm not messing with it. They have stickers, which somebody told me on here they're more for keeping water out. But I was told, because I complained about this issue to multiple companies, that I was told put the sticker on to keep the output in. But I don't trust the sticker. I feel like none of the stickers actually stick very well. So I will hot glue gun them. I actually have it over here. This is my station.
Oh, there it is. I thought it was upstairs.
This is my station for gluing my bags shut, because filters, I don't think anybody's...
DIY medical hacks.
Yeah. But I don't think anybody's like figured out the filter, which I don't know why, but I feel like we should get
provider
there.
Listening or
oh, I tell them.
Yeah.
I told him. That's what I do. Glue them shut.
And we're doing good. Mags, we are actually caught up.
Are we really?
Yeah, we're doing perfect. So,
yes.
Hey, hopefully we haven't missed anyone's questions, comments, anything. We're doing our best to try to stay on top of this as much as we can. But again, if you do have anything else, this is your time to shine. Ask away. But Mags, how bad was your Crohn's before deciding to have an ostomy bag? Which,
well, I mean,
it wasn't really a decision, unfortunately. Unfortunately, it was forced upon her. Yeah.
But it was bad. I mean, I was 16 and I weighed 60 pounds. And I wasn't eating anything. I remember I had a short period of time between finding my rectal stricture, which I had 3 strictures in my intestines, but that was the worst. I had a short time between stricture discovery and ostomy. And in that time period, I lived off of Miralax, prune juice, Dulcolax, drinking so much water, and to the point where I was basically only drinking fluids. Yeah. It was absolutely miserable, and I think that's why I just loved the ostomy. It just gave me so much relief, and even the abdominal pain that I had was immediately so much less.
Yeah. So I think we kind of touched on this a little bit previously, but just advice preparing mentally for anyone that may have joined in later, or just any suggestions there, Mags.
Again, I know I'm in a unique circumstance where I felt so sick before and it really gave me relief. Not everybody is in that. Learn as much as you can prior to surgery, and this is hard, but try to push yourself after surgery. I didn't change my own bag for 6 months. My dad did everything for me. It took me, I think, at least a month to actually look at the stoma. And I wish I had just tried to push myself a little harder. There was a point where I just closed myself off and didn't want anything to do with it. And that did not help me at all.
Yeah.
Because you have to, you just have to deal with it at some point. There's not always going to be a nurse or somebody caring for it for you. And it really does help to get that sense of independence back. It's really encouraging to feel like you've got a handle on things. And the only way you're going to get there is by learning, looking at it, changing your own ostomy bag, emptying your own ostomy bag. And in the hospital, your nurses will love you if you take that sort of attitude. I mean, obviously, they will help you with whatever you need. But when you take that just forward approach, we have to deal with it, so let's deal with it. So they're going to be very grateful.
I don't know if I misread or misinterpreted this, but thank your pets. So I want to give a shout out to the dogs, if that is what it was referring to. Got to give a shout out to them always.
I don't think that's what that meant. Thank you, pet.
Oh, well, I misinterpreted.
Did we miss their comment?
Oh, please. No, I looked. I didn't see it. It might have been deleted. It just didn't come in. Sorry if there was a prior comment. We didn't see it on our end. I came in half hour late, so maybe you answer this, but you have a video, the fun times you had.
I will. I've just been lazy in putting that together, but I did take a bit of vlogging footage. I just have to put it together.
Oh, wait, I didn't know. I thought you put your.
So I did the
different
conference one, and then
videos.
I did a separate one because Zach and I did. Oh, we found this rooftop bar. Well, not a rooftop bar, but a high up bar.
It's actually something I'd recommend if you're out there, or if you're local there, maybe you can speak to it. But it was something cool. Like we figured, like any of the like you have to pay a fair amount of money just to get a good view of the skyline in Vegas. So I read beforehand you can go to the Waldorf Astoria, and they have like not a rooftop bar, but it's like on the 20th, 30th floor range where it's free. You buy one drink and then you can kind of just look out and just take in the view. And that was one of the top things we really enjoyed there, as well as some of the shows and the comedy. The comedy club was also pretty good.
Oh yeah. Unfortunately I couldn't video either of those, but
Don't forget to take out the trash cans.
oh, thanks,
Thank you, Alexa.
Trash day is Wednesdays. I don't know why she tells us on Sunday.
Very thrown off.
Yes, there will be a Las Vegas video coming though.
Perfect.
You still have them out.
Oh, I do. I'm sorry. I'm
sorry, I keep coughing. It's just this lingering.
Video's informative, which thank you.
Oh, thank you.
You do. I would say you do a pretty good job. Can you give a?
I think that one I kind of already did. Crohn's disease.
Oh yeah.
Making my colon and rectum terrible.
Yeah, we're trying. I think. I keep saying spina bifida. Or am I spina bifida. I biffed it. Yeah, at least I'll turn it into humor. I'm just gonna pull that
when we say these jokes, we're not making fun of anybody. This is how we deal with our issues around here. If you're not laughing, you're crying.
But yeah, a lot of questions coming in on this, and I don't know. Is there really much we could talk about on the matter?
Not so much. I can't offer, but I think this is more to connect people who might be dealing with this. So,
oh, here's another one. I think I get it. Yeah. Has your life changed since creating this YouTube channel? And before, I would say the biggest thing for you, and when she started this many, many, many years ago, was there was no community, so she took charge and made a community. Which
it's not that there wasn't a community; it's just. It was a lot harder to find people dealing with the same thing, especially all of the intricacies that can come with Crohn's or living with an ostomy. So, you know, there were a few of us around 2009, 2010 that kind of just took social media. It was fairly new at the point and decided to talk online. But yeah, I mean, it's given me that community. It's given me a way to feel fulfillment, feel like even though I'm not working as an RN, I still can use that knowledge that I learned. And yeah, I don't know. That's how that's how it changed
or helped for you. Yeah, I would agree.
And so many friends too. So many people that I've met because of it, and opportunities to travel. Pretty much all of my traveling that I've done in the last 5 to 6 years is because of YouTube. And I have gone all over the country.
Met a lot of wonderful people, seen a lot, done a lot. So it's been very rewarding. And
I feel like I'm pushing you off camera. I'm sorry.
No, it's fine.
Just like landing close.
I'm just hiding. But this is actually a good question because I know this is a common issue a lot of people with ostomies have, which is just healthy skin.
Yeah. The thing that helped me the most, and this is something that you need to check with your stoma nurse or whoever is kind of your provider when it comes to ostomy stuff. I use Flonase, and I've mentioned it before, and people will comment and say, I Googled Flonase. It's nasal spray. Are you sure that's what it is? Yeah, that's exactly what I use. I do a couple of sprays of Flonase, and it has a steroid in it, and it helps to keep my skin from reacting to different adhesives. That's been really helpful. But obviously, there are risks that come to topical steroids and other steroids, of course. So you have to check because you might not be sort of a candidate. I know that some people use Flovent, although there's something going on with Flovent. It's a steroid for asthmatics, I believe.
But have you tried collagen supplements, and did you have any issues if you did?
I have not. I have not tried collagen supplements. Sorry.
Oh, no worries.
I'm I've been taking a number of different supplements now, but collagen is not one of them.
There you go. Do you suffer with large amounts of stomach acid?
So that was something I thought. Now I'm unsure. I had always had the diagnosis of acid reflux or GERD, but then when I was kind of mentioned about SIBO, they thought maybe it's not so much that you have too much stomach acid, but maybe it's lack of control of the bad bacteria, and that apparently has similar symptoms and makes you feel like you have acid reflux. So it's kind of risky. I started taking that hydrozyme.
Yep.
At the direction of a nutritionist, of course. And that's adding acid to your stomach, but it's supposed to help control bacteria. And I was really worried. Oh my God, I'm literally adding, I think it's hydrochloric
acid.
Yeah. I think that's, don't quote me on it. I was like, if I've got GERD, then we're going to know it. This is going to be awful. And I actually found so much relief in it by adding acid when I eat food.
Yeah.
And I haven't had any.
It's helped a lot.
Acid reflux symptoms
Again,
in a while.
At least for her, I don't know if it's going to work for everyone, but it's.
And it slowed my
I've
ostomy.
seen it's helped a lot for you.
Oh yeah, it slowed my ostomy. The last time I got fluids, like IV fluids, was.
Oh, it's been a while.
It's been a while because I've had appointments I've had doctor's appointments that fall on my day of fluids, so I haven't been able to go. And thankfully, I've been okay.
So another question: was it hard for you to start having a social life and do normal stuff that healthy people do after you got your ostomy and felt better? So how was it once you had your ostomy, just returning back to your day-to-day life?
It was truly harder beforehand because I was absolutely miserable and just so I looked like a pregnant child. That's what I looked like. My belly was so bloated.
Yeah.
So after the ostomy, I was worried about having a social life, but I had a really good group of friends in high school, and I've mentioned her many times on my channel.
She's going to come up in 2 questions.
Oh, is she?
Yeah. Well, yeah, you'll say.
Well, do you want to? I'll bring it up if.
Which, speaking of, did you name your stoma? And I know.
Okay, so this all ties in together. So my best friend Kelsey, who I got to see at the conference this past summer in Texas.
Hoping to go back again sometime soon. Yeah,
she didn't allow me to recluse myself because the first day back at school, she pulled me into the bathroom and she said, I want to see it. I said, you really want to see my ostomy? My bag is clear. I don't have a cover or anything. And she goes, I don't care. I want to see this thing. So I pull up my shirt and she sees the stoma. She sees all the other things that happen in an ostomy bag. And she says, we have to name this. We're naming it Leroy. And that's its name. And that's what has stuck since. And she has been very supportive. She is the person that when I got my proctocolectomy, a week after, she texted me and said, hey, not to be weird, but could you send me a picture of your butt? I want to see what it looks like.
Yeah.
She just, she was so supportive and just didn't give 2 bleeps about an ostomy or whatever. I was just normal to her. So that really helped me get out into
honestly,
life.
for you, like you were saying, it gave you your life back. Having your surgery, having your ostomy, you were back to normal for yourself. So
and when you met me in college, I had my ostomy for 3 years at that point, or 2 years. So when he met me, that was not the focus. Yes, it existed, but I wasn't questioning him about his bowel habits all the time. So,
fair.
I was a regular person. We played soccer together in college on our intramural team.
It's not always the best comparison, but like I say, it's for me with glasses. They help. I can see decent without them, but I see better with them. So it's just a part of me. It's just Roy is a part of her, and we don't really think about it. It's just us. Yeah,
I'm not flapping my ostomy bag in his face all the time.
No.
Maybe I should.
But here's a question. Do you think you ever need a J tube?
No. No. I don't have any need for a feeding tube. And in terms of if I did at this point in time, there's no reason I would have to skip the gastric part of it and go for a J tube. That was part of my job. I dealt with a lot of G's and J's and GJ's and all the different types. And I know that J tubes can be a bit of a struggle, especially in the placement of them.
I like this question. What's the worst advice you've been given about Crohn's disease throughout the years?
Not to talk about it.
Fair.
Sorry, Dad. My dad didn't want me to talk about it because he was so afraid that I was going to be judged for it. So when I was first diagnosed, I was put on steroids, got the round face. I had all these people questioning me, all my friends. Why are you looking so puffy out of nowhere? And my dad said, I worry about you being made fun of for this disease. And I said, I don't care. I'm telling people. And so I did.
Yeah.
And that.
But you're an advocate.
Yeah. And now he's my biggest fan. So.
So another question I saw was thinking what you do when the skin is bad and allergies for something you can have a flange on the skin and what you can do then. So I guess just issues with your skin.
Sorry, I'm struggling to read it.
Like if you have allergies or issues with your
I mean, that's kind of why I use the Flonase is for.
Yeah, I guess that's probably the
allergies.
best answer.
And all I do with the Flonase, it's a very thin liquid. Do 2 spritz on the skin, seal it in with a little bit of skin barrier spray, and I have no issues with the bag sticking or anything like that. So that's been really helpful.
I'd like to hear your husband's input on dealing with your health situation and the awesome understanding. So honestly, for me, it's she's my wife and I'm just there for her. It's better for worse. You're just there for them. To me, it's not, I just want to learn hello, Kitty. Just want to learn and know more about it so I can be supportive, helpful. And again, like I said earlier, sometimes there's nothing you can do outside of just being there for them. So you just got to kind of learn their body emotional cues and just become attuned with them, I guess. Yeah. And just be there for them, honest. I know it's redundant or repetitive, but that's the best advice I can give is just to be there for them like any other family member, friend. That's the best support you can provide. And
my favorite way that you approached anything with my ostomy, like when it fell off in your bed when we first met, you were just so nonchalant. Like you didn't make a big deal out of it. You were like, oh my gosh, like it's okay. Everything will be fine. You were just like, oh, well, why don't you jump in the shower and just clean up? And I will put the sheets in the wash. Yeah. And you just moved on. Like, we're handling the situation and we're going to move on. It's not a big deal. I was so afraid that was like the end of our relationship. And you just like didn't even bring it up again.
It's out of your control.
Like, the next day you called me like, hey, when are we hanging out? So, and in terms of just being there with the PMDD that I had dealt with a couple years ago, it was absolutely horrible. One of the hardest things I've ever gone through and dealt with. And there was nothing that Zach could do. And there was no way for me to explain what I needed. And I don't know what I needed. But he learned, I think, pretty quick that just sitting next to me, like we don't have to talk, sit in silence. But just you being right here was the best and so helpful. And
unfortunately, I feel like some people just, they don't understand or don't do it. But that's all it takes at times is very little. Means a lot. There's not
always going to be that answer that you.
So yeah, I've given this answer before, and I know it's not always everyone's best answer, but that's just honestly how it works for us, or how we do it. But have you had any diabetic changes since your surgeries and diet changes? So I know we kind of covered diet a little bit before, like some things that you do or don't do. But what about I guess diabetic change? No, I don't know if that's really been an issue. Fortunately,
no sugar issues, none of that. I was also a diabetic nurse. If you didn't know, I was pediatric GI, endocrine, metabolism. So I had all the type 1 diabetics, just a couple type 2, but thankfully no any type of diabetic issues, knock on wood. So
how long did it take you to become comfortable with Roy, and was it painful at first?
It was quite painful just from it being an emergency surgery, and peritonitis. Peritonitis is a painful thing to go through. It is like somebody set a fire inside of you. Any surgery recovery though is painful, and it was pretty raw around the stoma. The junction between where your intestine sits and where the skin meets it does have to heal. It's a very delicate area, and sometimes there's separation. So had to be really careful with that the first few bag changes. Wish that there was ostomy adhesive remover at the time.
Yeah.
If there was, it wasn't available in my hospital. All they gave me was like the oily citrus scented adhesive removers, which you should not use around your stoma because then your bag won't stick. But over time, pain reduces from surgery and that area healed, and there's no pain anymore. I don't feel my stoma. It's just like I don't even feel the bag sticking to me. I'm just so used to it.
You get used to it.
And it took me about 6 months to get comfortable with it. I actually, about 6 months after I got it, started dating a boy with an ostomy. A friend introduced us, so saw him dealing with it, living life, and I was like, I don't even give two thoughts about his, so I probably shouldn't worry so much what people are thinking about mine.
So, have you ever had a hernia? I don't believe you have.
I have not.
So,
I'm still at risk for one because I've had many incisions on my belly, but for whatever reason, I have not had a hernia. I've been so grateful for that. I started playing soccer. I went back to soccer, I think the spring after I got it. So I had surgery in October, and then maybe around April started playing soccer again.
Yeah.
So what is that? Like end of October, November, December, January, February, March. 5 to 6 months I waited. That's really the extent of my physical activity that I did in high school right after surgery. So
any advice for traveling long distances, especially with Humira?
Yeah. Okay. So that video that went a little big on the channel that I think some of my new subscribers came from was my ostomy bag getting big on the plane, and I couldn't deal with it because the plane was descending, and I kept like going to Zach. I'm like, oh God, it's getting big. I feel bad because that was the first time many people who subscribed wound up seeing me, and I hope I didn't instill fear on flying with an ostomy because I have flown so many times. I flew all the way to, I guess I flew to Amsterdam and then from Amsterdam down to South Africa. So it was like 19 hours of flying, and I did totally fine. The things that I do is I make sure that I eat regularly. Some people will starve themselves before flights. I don't think you should do that, because why starve yourself? I think that's pointless. But also, it gets your intestines into a weird rhythm where you don't know when your ostomy might become active. If I stay on my regular diet, then I kind of know, okay, I ate at 10 o'clock, so my ostomy will probably start to get active immediately after, and then probably 4 or so hours later. So what I usually do is I eat before I get on the plane, get my ostomy active. I'll go to Annie Ann's and get my pretzel. Get my ostomy active so I can empty it right before I get on the flight. And then I've got a few hours. So flying domestically, like 4 hours is a pretty good time to get anywhere.
But international.
But I've actually had a bag leak on the plane, and it was totally fine. All I did was had some paper towels with me. I say carry some paper towels or some tissue or something. So if you do experience a leak and you can't handle it right away, just tuck it around your ostomy to buy you some time. It's exactly what I did until I could get, through the couple of people that were sitting beside me and get to the restroom. And of course, I carried an extra bag change just in case. So I did my bag change in the flight and it was totally fine. I also used deodorizer. I know people are worried about leaks and then there being odor. That's the great thing about ostomies is the deodorizers you can add to your bag totally neutralizes. So no one knew.
And how about traveling with injectables such as Humira, getting through TSA and all?
So we just did that. We just did that to Vegas, which I got to talk to Aaron because Aaron and I took our injections together and neither of us have posted that video.
Oh, right.
But we just did that. And I was like, Zach, I wonder if they're going to I always get nervous. I always get nervous with it. Like, are they going to bug me about it? Are they going to worry about it? And you know what? I have not once had issues. They do not seem to care. The only thing that I make sure to do is carry any of my injections in the box that it comes with that has the prescription label on it. So that way, if they do question it, like, yes, it's prescribed to me. But yeah, they have not cared. Put it in
Unfortunately.
I had it in my purse. And I even opened up the top of my purse, like, here, I'm not hiding anything. Here it is. And they didn't care. So
Yeah.
there you go.
So you can travel with it.
If you need a cooler, there
Should be able
are
to.
small injection coolers. Thing about my drug is that it can actually sit out for 14 days, unrefrigerated, and still be good. So I don't worry about it. I'm not bringing a cooler with me.
Another question: are bowel movements reduced once you have a stoma back to about 1 to 3 a day versus prior to?
It depends on the type of stoma that you are getting. I know that people with colostomies tend to have more solid output and a bit slower. For myself, when I first was diagnosed with Crohn's, I was not so much on the constipated side with the strictures. I was more on the multiple bowel movements a day and bloody and all that fun stuff. So compared to that now, it's probably the same amount of times per day, but it's less painful and no blood. So like plus. 5 to 7 times a day with an ileostomy.
And it kind of ties to the next question. Have you ever had an issue with your body weight going up or down? And that's one thing that has helped keep it consistent and going up back to a more healthy weight for her frame.
That was before ostomy surgery. That was one of my things that I just was so self-conscious about. I felt like a child while all of my friends were going through puberty, and I just was not hitting it. So, I weighed 60 pounds at the age of 16 and then got my ostomy. We took the colon out of the equation. I gained 30 pounds in a month. So I bumped to 90, which was absolutely insane for me. I'd never seen that weight in my life. And, over the last few years, I've definitely had some times like I dropped to 88 a couple years ago. And I just felt like I look so skin and bones. And now I'm thankfully around 103, which is the highest I've ever been. So, but now I'm like, oh, wait, am I doing too well? But
You're doing great.
I would rather have more than less.
Yeah.
But I have had I have that weird relationship with food because it's just,
And
I have videos on my channel about it because that's like one of the things that I feel weird talking about sometimes. So, and I know that some people are sensitive to it, but I do have specific videos on my channel talking about just the weight struggle and really trying not to focus on the number on the scale, but more how I feel.
And again, kind of related question: are you in remission? I would say for the most part, I feel like she is or has been.
Yeah, I mean, there's definitely symptoms that come along with having an ostomy that aren't Crohn's related, but as for Crohn's disease, I have been in remission since I started 𝙗𝙪𝙨. And even before I started 𝙗𝙪𝙨, like I feel it's kind of hard to explain it. When I had my colon and rectum, there was some Crohn's disease. Maybe it was diversion colitis, but it was kind of like a mix. They weren't really sure. So that was active. But as for the intestinal tract that was actually functioning and being used, there was very little disease. I had right near my stoma, I had some inflammation starting. They put me on 𝙗𝙪𝙨. It's been gone since. So no, I have no active inflammation for Crohn's right now.
And just when they post this, I saw that come up too, which thank you so much for that. And we're sorry if we missed anyone, either members or any super chats, but we very grateful for it. And thank you. But honestly, the biggest support is just the interactivity, I think, and just the community. So we appreciate that immensely. And then this is another good question. Are you still practicing nursing, or why are you not practicing nursing anymore? And would you teach if that was an option in lieu of it?
So as for nursing, I left my nursing job, my bedside nursing job, because of proctocolectomy surgery. It was a whole thing. The amount of time that I worked was not eligible for FMLA. And even if I did increase my status at the time, I wasn't sure the FMLA was going to cover the amount of time I needed. And it turns out that it wouldn't have if I had stayed. And so my manager at the time was really pressuring me, and I was stressed out about it. So I talked to Zach. I had actually been working another job as, working telehealth and for an ostomy sort of company. And so I talked with that company, seeing if they would up me to full time, and they did. And so I just transitioned, and it was a really nice remote job that I had at the time. And eventually that job did turn into a nursing role as we were starting a ostomy nursing program. And unfortunately was it 2021, I think, that company went out of business. That was 11 Health. So I left before they went out of business because I kind of saw what was happening, and really just focused on my health, because I think that was around the time I had kidney surgery, and we were going to get married in a couple months, and the barn, which many of you know, that whole ordealio. So
another day, another time.
Yeah, but then I, really focused on YouTube, and I've really loved that. I've always loved making videos. I've been making the videos since I was 16.
Do a wonderful job at it.
I think that I enjoy doing it at this point. And I can connect with way more patients this way than I can as a nurse. And that's the reason I became a nurse, was to talk to my patients. And I think all of nursing right now is struggling.
It is.
By the time I left, there were too many patients I was caring for at once. It was too stressful. There were issues. So I won't go into too much detail, but there were issues, and my mental health was not good at
long
that
story.
job.
It's just, for her and for us, it was just the best course moving forward, and it worked out. She's still an RN. She maintains her license.
Yeah. And I utilize it in different ways that aren't conventional, that aren't necessarily on YouTube. Like, I help a company with their CE classes. That's just like the units that you get as a nurse, or other healthcare workers get them as well. But it's continuing education units. So I help in different aspects where RN licenses are required. I just don't need it for YouTube. Just like a little bonus. Although YouTube did come out with that thing for healthcare providers where you could get like a special thing.
Yeah.
And I could have gotten it for that. But then I thought, you know what? I really like sharing from the patient perspective, and being held to that medical standard when sometimes I talk about, the personal stuff. I was like, I don't know if that's going to mix too well.
So another question about bladder spasms. Did you ever have air? I want to make sure, hopefully understanding.
Did you ever have air? I don't know what that means. I'm sorry.
Care if you want to repost that. We're apologies if we're misunderstanding your question there. But happy to answer it if you just want to I get posted again, and we'll get to it very shortly. Speaking of shortly, do you have shortcut syndrome?
Thankfully, I do not. I have most of my small intestine. They only took, I think, about half of my terminal ileum. Yeah. So very fortunate with that. That's why I'm on the HUMIRA, so I don't have to lose anymore. Hopefully.
And I'm trying to recall. I actually can't remember if you had, but I thought you did. Did you ever get TPN?
Twice.
Did you like it? No.
I mean, it certainly helped. I'll tell you what it helped me with. My nails were never in better shape than when I was on TPN. They were long and beautiful. They just basically peel off of me regularly. So that was the one benefit. But yes, when I first got my stricture discovered, I was on TPN through a PICC line, which I have a small scar on my arm. And then when I had ostomy surgery, I was hospitalized for 35 days, and I had a central line, which I don't know if you can see it. Do you see those little dots right there?
Yeah.
That's where my central line was. So I got TPN during that time. But then they saw that I was eating so much after ostomy surgery that they quickly were like, we don't think you need this anymore.
So a few questions. I think this came from another something we talked about before, but it's about your weight and sports, being about when you were at 60 pounds. Did you participate in sports? And then
I did.
Is height a factor? It's an ideal weight. So she did.
I did play sports. When I was put on steroids, I was really good. I was very aggressive in soccer. But as I started to get more sick, obviously I was not very helpful to my team. I was definitely one of the smallest.
Still did better than me at soccer.
Yes, I did.
That's how we first, one of the first leagues, or how we first met.
Yeah, I was definitely one of the smallest. As for my weight, I know 103 for many people is like, maybe that's not enough. I'm only 5 foot. I am fairly short. And I don't know if that's because of Crohn's, if I just didn't get tall enough, but like my aunt is, what is she, like 5'2"? My mom was 5'3". We're not a tall people. We're a short people here.
And I think we kind of went over this a little bit earlier, but what about just scar care?
I didn't do much scar care other than making sure the incisions were closing, and if I felt there was any issues, I went to the doctor. I 100% definitely didn't pull out my own stitches. I did one time. But as for the scars, what I was told to do with my scar was to massage them and massage it in different directions. So my pelvic floor therapist, of all people, was the one having me do this. She was having me go up and down, side to side, pulling the tissue apart, pushing it together. That's what I did. I never put any sort of, I don't know, like vitamin E cream or whatever scar cream people tell you to put on it, because scars never bothered me. If anything, it was proof that I was sick inside, because most people didn't believe me. And when I had scars, I was like, see, it's real. So
another one. Thank you very much, Brandon,
for the
courteous donation. And again, continued support from everybody. Really, and I did see a question that kind of fun one. Where was it? It was about our.
We have a troll. Are you taking?
I got rid of it.
Okay.
Sorry. Yeah, there was someone that was just spamming comments. Sorry, it took me.
Before I even see it.
Yeah, sorry about that, guys.
You're a good moderator.
Oh, here it is.
I'm just clueless.
I've been watching videos for years. Thank you.
Oh, God.
And wondering about what happened to our chickens. So
they died.
Predation has been the biggest issue.
At first, I thought, because we had chicks maybe 2 years ago, and they were fine. And then we put them out in the coop, and they were dropping one by one. So I'm thinking, is there some illness that I am not aware of going on with these chickens? But what I think it was, because we started to notice these holes around the edge of the coop. Yeah. I don't know if it was rats or what. Something was out there getting them. And we were down to our last chicken, and they're really they're kind of social, I think. And so we decided, let's just bring her up to the house, and she'll be a house chicken. And she died within the day. Yeah,
I mean,
I thought she was healthy. I don't know what happened. I feel like it was my fault. I feel like I shocked her.
Yeah.
I don't know.
We had them for a while.
They're devastating.
Did well, but having livestock chickens, animals, there's a lot of risks. And
you have to be set up for disappointment with them, it feels like. And I don't know if I just didn't. I mean, I tried to do all the research and stuff, and tried to do all the right things. Oh gosh, there's this lady that's on Facebook all the time. She live streams. I want to say it's like the Chicken Lady or something, but I used to follow her. And she had just beautiful coops and stuff. So we have a really nice coop, and I just think something got into it, and I don't know how the way that our coop was designed, remember the fencing, it actually went under.
And the ground, so nothing could dig up, but
something dug up through it.
Nature's persistent, as are other creatures. So
maybe in the future.
But as of now, we are just the doggos.
Yeah.
And us.
I liked them.
But
except for the one rooster that would attack me.
Another outdoor question, but will you be doing more gardening videos this spring, summer, or?
If I do, they will be a lot smaller scale. Just life and the things going on. It's just, I want to keep it small scale. I feel like every year I get so excited about the number of things I can grow, and then I don't do well with any of them. So if I focus on a few select things, my green beans, my cherry tomatoes, and my Amish paste.
I liked your peaceful walks just down by the creek or something. Those are nice, where it was just a relaxing.
Didn't I do one with the snow recently? I think I did.
So
I am hoping
TBD, but likely to come. Stay tuned. How are your fluids going? And And it was something you kind of just said that you're right now not doing as many of.
Yeah, I think my last one that I had done was maybe early January or late December. I can't remember. But I had to cancel the last two just because I had an appointment the day that I was supposed to go. And like the times I couldn't make it all the way out there. But at the same time, I was like, I don't know if I really need it. Like, I feel pretty good. I've been switching. I just got a shipment of liquid IV and the Elementy. I've been switching back and forth. So like every other day I'll do one or the other. And, drinking herbal tea and water and some bone broth mixed in there. I've been doing okay.
So I think this was the question from earlier. If this is more helpful, bladder spasms when you had them, did you pass any air?
I did not know. Unless like they were like I had oh gosh, what's it called? They put the scope into your bladder. I had like it was a little weird feeling, but other than that, no.
And did you ever use mesh with your ostomy? I'm unsure what that means
like
myself.
Internal mesh? No. I think my dad did for his hernia.
And oh wow, we've been going a while.
Oh wow. Didn't I say an hour?
Yeah, we would go over. So we're probably going to we'll answer a few more of the last couple of questions here, but we're probably going to be wrapping up. We still got some errands to take care of this evening for ourselves, and backdrop is getting dark. We're noticing the sun setting on our end, but we have appreciated everyone staying here, and let's just try to get through the last couple, which
oh, thank you.
Oh, did I scars?
Hey, I'll take the compliment.
Yeah.
You can show that.
And then Tic Tacs to stop the meal. It's amazing.
Wait. Oh. I haven't tried Tic Tacs. I've tried Altoids.
Do you feel comfortable going for long walks with the dogs, and does it affect the rest of your day? It's always relaxing and therapeutic.
Yeah. We like walking the dogs. We've done some hikes with them before. I usually get a little worn out sooner than he does. You've ever heard our engagement story where I didn't make it to the scenic vista, so he had to propose like behind a rock or something. Does it affect me for the rest of the day? Sometimes. I mean, I would say I probably get worn out a little faster than most, but I bounce back pretty quick.
But and I think the other couple questions were just really, sorry about the chickens. I'm just appreciating the comments or the help, and
has my IBD inflammation reduced since my operations? It's more, I think the operations just got rid of the inflammation that I had, and then Humira has kept it in control.
Yep.
From like other pieces of intestine getting it.
People wondering about the chickens.
Yeah, I know.
No, and we appreciate everyone's comments, commentary, questions.
Yes, that's the word I was looking for. Thank you.
Oh, I don't know.
I just thought. All right. Well, I don't see any more questions.
Again, we did our best. We apologize if we missed anybody. We'll try to do up to Mags, but try to do another live stream in the near future to just kind of chat. It's just really supposed to be open dialogue and just
and
relax and chill on a Sunday evening before the week starts again for everybody.
I'm grateful for everybody coming today and hanging out and chatting with us. That is so cool to me and will always blow my mind. But yeah, thank you so much for watching today. And there will be new videos this week, I'm sure, as I often do.
But everyone have a wonderful remainder of your Sunday, the weekend, and then upcoming week going forward. So
we will see you guys very soon.
But thank you for all the support.
Bye, guys.